Health IQ Podcast, Unseen Grief, Loss Beyond Death.
Today, we will be discussing a mental health issue that all of us have experienced at one time or another. Our crew today is Joyce Runyon and Bobby Hockaday, and our special guest is a new therapist in town, Dr. Rebecca Hodge, and I am Brenda Bishop. Dr. Hodge is a new clinical director for Professional Counseling Associates.
Yes.
Get that title correct. And also returning to Quake County. It's so great to have all of these young professionals returning back to our community where they grew up.
Yes.
And I remember them as little people. So several weeks ago, we were in a meeting and you mentioned grief.
Yes.
And talking about grief in a different way than I had thought about grief. And that's what made me think, yes, we all are experiencing grief. And so we thought it'd be really great topics. We're glad you came to visit with us today. So I figured we should just start with what is an overview of grief?
Well, thank you for the invite. This is my first time being able to share this outside of a counseling experience. So it's nice to offer up some, at the end, hopefully it can offer some practical tools that are supportive if someone's going through grief. But the first thing I want to talk about is obviously there's grief from a loss of a loved one or someone we care about. But today I want to define grief beyond just death, right? And it's beyond just losing a person. This can stem from divorce, a job loss, illness, or identity shifts. Kenneth Doka, sorry, I want to make sure I get these names correct. He coined the term disenfranchised grief. And these are losses that aren't seen as significant by society or that aren't socially recognized. So I think those are important to talk about. Some just off the top of my head are infertility, estrangement, loss of a pet, death of an ex-partner, or loss of a casual or secret relationship or an affair or an estranged family. So these are losses and things that people grieve that we don't often talk about.
Well, I can even think of things like, for some people, an election that were so embedded into the outcome, or if they were the candidate, that's a loss, and that's very hurtful. So I could see that being grief too.
Yeah. And sometimes this disenfranchised grief are grievers who aren't supported. Some of these come from the LGBTQ plus community where their partners are not legally recognized. Friends of grieving someone who isn't a family member, or caregivers of those with dementia who are grieving a living person. And some of these losses, they can carry stigma or judgment. This is a loss of someone of suicide, or it could be a loss of an overdose, just things that aren't being talked about.
Right. Or it could cause those issues as well if you don't manage that.
Yes.
And I do know people who've dealt with that, loved ones with dementia, and how they grieve over not having the conversations they used to be able to have, or do the things they used to be able to do.
Yeah, I really appreciate you bringing that up. My grandmother had Alzheimer's, and we often talk in my family. We had the loss of her when the disease kicked in, and then we had the physical loss of her when she passed, and we were grieving for years in between that. And outside of my family, that's hard to it was hard to explain to somebody.
Or health issues.
Yeah.
That's a grief too, even if you do recover.
Yes. Another, I think a really good example of this, and it's hard to bring up because I think we're still dealing with the after effects of it, is COVID-19, right? And so in COVID-19, not only were people losing not only were people losing loved ones, they were losing their traditions of mourning. There were virtual funerals where people couldn't attend. And I even heard of some people who didn't even get to have a funeral or that time to gather and have support. So that type of experience and grieving by yourself is just really difficult to do.
And people grieve the loss of being able to be with people.
I think we still see that grief, right? Just the shift in identity for some people. Myself, I worked in person as a clinician, and I got to sit with people, and part of my identity shifted where I had to do that online, and the person wasn't with me. So there's a loss of identity within a really good, not a really good example, but within COVID-19 and the after effects, I think we're still seeing. I don't have kids of the age, but those children at school who lost prom or sports, it's all a lot to grieve.
Scholarships, or just didn't finish school
Yeah,
because they couldn't handle that transition to online,
yeah,
because it's not for everyone.
it's definitely not.
So that's some of those things that we don't think about as grief. But there's some common types of grief. There's the death of a person, and you said the loss of like an income or even moving to a new community, because you lose that grief. You have grief of all the friends you left behind, especially for children. Are there other common types of grief?
I think another big one that is complex is divorce. It's still a loss. I think sometimes in my field, I see it more affecting the children, right? But it still affects the partners, right? It's still a change. Divorce, there's like the top 5: divorce, death, loss of a job, loss of identity. They all carry some grief with them. And I think what's important to talk about too is just acknowledging that. I think grief sometimes is really tightly related to death, which is taboo, right? Do we mention that? Do we not mention that? So one thing that's really a practical tip I wanted to share is acknowledging that people are grieving. We are all in probably a different stage for a different reason, but it is okay to bring it up. It is okay to talk about those things.
So I just saw something, I think it was on TV recently, that there are this different stages for going through grief. Maybe, do you have those?
That was really great. That's exactly what's coming up next.
Oh, okay. That wasn't on my notes, but
We're doing great.
just thought about that.
So, yes, there's some pioneers in the field. Kubler-Ross came up with the idea of 5 stages of grief. The first being denial, anger, bargaining, depression, and acceptance. So before I share any more of that, I'm just curious, are those the stages that you have heard of before?
I've actually have heard of those stages, but that they just said I'm going through the stages of grief on whatever it was that I was watching.
So when Kubler-Ross came up with these stages, she meant it as a linear path. You're going to hit this and then this, and we have found over the years grief doesn't work that way. Maybe you're in denial, maybe you move into bargaining, maybe depression comes up. And I think for me, a big piece, another stage that isn't often talked about is shock. And shock is really related to your physical health. It's really important if you're grieving, whether the loss of a loved one, divorce, whatever, disenfranchised grief that we're talking about, your physical body goes through things, right? And it's important to be aware of shock being part of that. Your body doesn't know how to respond. And sometimes when I first meet somebody who's grieving, they don't seem that way. They're not emotional. They're just going through day to day because their body and their emotions, I consider it that they're in shock.
I can see that. I've seen that in people too. And whatever the issue, the thing that caused the grief, it's okay. And that's sort of how I deal with things. Okay, we'll just push that aside, and we're going to get through these 5 minutes and 10 minutes, but then eventually your body catches up.
Yeah. And I think it's really important that to talk about, even with COVID-19, people are still in shock, right? People are still experiencing the aftermath of that. So if it's okay, I wanted to share some practical tips, right? Because as a therapist, I do talk with people about these things, but I wanted to give the listeners some verbiage that may help. Is that okay?
Sure.
So most importantly, you may not know what to say, but saying nothing, it makes it difficult. You may not know the exact feeling or what somebody's going through, but just getting uncomfortable and walking away, that's not what I want people to do, right? So first and foremost, you can acknowledge their loss. A good way to say that is that must be really hard for you. Just acknowledges that there's been a loss and then it's hard, right? You can validate someone's grief by saying your feelings make sense even if others don't understand those feelings. And creating some space for mourning. So creating space for mourning, the way you could do that is by saying, do you want to talk about them or do you want to talk about what this has been like for you? And if we can, we want to avoid minimizing or comparing, right? So we don't want to say, well, at least it wasn't worse, or it's not like they were your spouse, right? So if someone is grieving like a non-death loss, a divorce, job loss, identity, instead of saying you're better off without them, maybe saying, I know this loss is painful and I'm here if you want to talk. If they're grieving in an unexpected way, like they're not outwardly emotional, like I said, if someone's in shock, instead of saying, you don't seem that upset, you can say, everyone grieves differently and I'm here for you, whatever you need. So I just wanted to give some practical.
Those are really good. I was thinking about that because, I never know. Do you bring up something that maybe they are trying to get past,
Right.
to say, oh, I'm sorry this happened to you? But you're saying it's better to go ahead and acknowledge it and say something than not.
I have clients who are dealing with grief and loss in different ways. And if we skip the acknowledgement, we wouldn't talk about a lot of anything, right? And yes, I am a therapist, and so we do dive into that a little bit more. But with your friends and family, it's okay to acknowledge that and say, oh, things are tough right now, or they have been. And I'm here if you want to talk about that. And if you don't, that's okay too.
That's really great. I'm glad you brought that up for those of us who aren't going through the grief, so that we can help our friends or our loved ones or whoever if we feel is going through grief. So what if we are the person going through grief? Are there some tips for us to help us get through it?
I think that's a really great way that you said it is grief is something that we carry with us, right? And I often hear people say, I just got to get over it. I just got to move past it. No, you don't. We have to learn how to live life with this change, maybe with this loss or without this person. But grief is something that you carry as time goes on. I hope for everyone that it gets lighter, but it's not something that you just have to, oh, I'm just healed. There's no more grief. Everything's fine. So acknowledging it for yourself. Mm-hmm. And I think this is where we can move into some cultural things, right? So beliefs of afterlife, beliefs, whatever people are believing, they can utilize for their own healing within this process.
So there's spiritual stuff.
Spiritual stuff. I tend to like to share with clients the elements, right? Earth, fire, wind, water. So with earth, right, if we have a loss, we'll bury someone, we'll put them back into the earth. Sometimes I'll have clients, or even myself, I've done this, where I write down the thing that I've lost or the thing that I'm sad about, bury it, environmentally friendly, bury it, or fire, right? I've had some clients, myself included, where I've just thrown things in the fire, I know I have to live with this loss, but I don't have to hold on to the sadness that always comes with it. Those are just some, depends on your culture, depends on your beliefs and what you feel is helpful and healing for yourself.
So there's no set way to get through grief. It's different for everyone. We realize that. And, but always the first step is to acknowledge that we're even in grief.
Yeah. I think
or having grief, I guess, not in grief.
Well, and I think those stages are helpful, right? Those stages are, right, maybe today I'm denying it. I don't want to talk about it. That's totally fine. You're allowed to be there. Acceptance is that final stage. It's not impossible, but it's a process to get to that level. And when you do, that's when healing can start. I think I also wanted to talk about grief is the start to healing. Grief and going through the feelings and going through the emotion of it all is what you have to do to get to the place of healing. To understand in the beginning when my grief is so heavy, that is grief. It's a lot to hold on to. But healing comes with carrying it, understanding it gets lighter. It's going to look different, and I'm going to accept that this is my new reality. But I get to carry that with me. It just doesn't have to be as heavy as it used to be.
And you said something I was thinking about journaling as a way to maybe help you go through all that stuff. I'm not much of a journaler, but I could see that could be something that could help you connect.
I love that you brought that up. I'm really big about journaling. I think it's also important to talk for a second about the brain. Okay. So the brain is always trying to figure out why. As a therapist, I can't offer you that why, right? Maybe your priest or pastor, somebody you confide in can offer that why, and sometimes not. What your brain is trying to do is make it make sense. So journaling is a great way to give yourself multiple different reasons. They may not be right, they may not be wrong, but it gives your brain a spot to go, oh yeah, we can think about that. Oh yeah, we can go there. If you're okay with it, I'll give you an example of my own life and grief that I've dealt with. I lost my father in a car wreck, and I can tell you he passed in a car wreck. Why? That still is hard for me to understand. So one story I have is a deer. It's the story of the deer that ran out in the road, and that happens, right? That happens here often, and that's really comforting to go to. I don't know if that really happened. Another story I've written is about that truck driver, that angry truck driver who, and it was a really good story on vengeance, and I really hated that person for a long time. I don't know if that's what happened, but I gave my brain some different scenarios to go there. So as I'm grieving or as I'm going through it, I can say, oh yeah, it was that one. I could only do that through journaling, right? And so journaling is a really great process when you don't have the answer, but you want to give your brain some relief.
Yeah. I got that. Yeah. So the other thing that I was thinking as you were talking about all these stages is it's a long process.
A very long process, yeah.
And I think some of us feel like we need to rush that and get through it. And why are we still feeling this way 6 months later or a year later?
I think that's where society and as friends, family, neighbors, it's okay to be patient. It's okay to be patient with ourselves. It's okay to be patient with one another because grief does not have a time limit. I would love to tell you, right? It's only going to take you this long. You do all these steps and you'll be over it. That's not how it works. So another really practical tip I want to offer is if you know someone who's going through it and or have lost something or something's different and they're grieving it, that's okay. Being patient with them and letting them be patient with themselves is kind of a step away from what society teaches us, right? Society says, pick yourself up, keep going, and it's okay to be sad. It's okay to feel those feelings. Often I meet with people who are trying to not feel feelings, right? Trying to push those away. And what we do often in therapy is let's just sit in that uncomfortableness, right? I don't know if you can necessarily do that while you're at work, or so there's also, it's practical with the journaling to do that when you have the time and space.
Well, and some of us need that break, so maybe going to work can help, depending on who we are. So I know then there are some people who just really need some help to get through their grief. What are some of those signs and where they might need to seek some help?
I have a long list, but I'll just give you some.
Give me something really general and.
If it's getting to a place of you're feeling isolated, you're feeling detached from your emotions, you're having thoughts of harming yourself or others, that's a time that I would step out and ask for help. We have a crisis line across the state of New Mexico that anybody can use at any time.
Let's say that 988.
988, yes.
So all you have to do is push 988.
All you have to, day or night. It's a great resource that we have. And that's a more brief, if you're looking to speak with someone, there are a lot of different clinicians in and around town. I work for Professional Counseling Associates, and I just hired 3 new therapists. Now, it's going to be more of a telehealth situation, but there are people who want to work and want to help. We want to make sure everybody's doing okay, and reach out if you need that extra support.
Well, I'm seeing that you do still have quite a bit you'd like to share with us. So if it's okay with you, we're hit our time limit. Can we go ahead and have a second episode?
I would love
sometime
that.
where we share that. So we do want to thank you for coming today, and so we have a gift for you with one of our Health IQ mugs.
Thank you.
And we do want to let all of you know that we will have some more important topics. So please come back. Maybe we can run these back to back so that you can have the whole story. So come back for another episode of Health IQ.
Thank you.
Special thanks to Dr. Rebecca Hodge, LPCC Clinical Director, Professional Counseling Associates. Our host was Brenda Bishop.
Health IQ podcast crew. Our director was Robert F. Hockaday. Our producers are Robert F. Hockaday and Joyce Runyon. Our camera operator, Robert F. Hockaday. Our second camera assistant, Joyce Runyon. This episode was edited by Robert F. Hockaday. Credit music was provided by David Morris. Funding for Health IQ provided by a New Mexico Better Together grant. Brought to you by the Quay County Health Council. Follow us on YouTube, Facebook, and Instagram at Quay County Health. If you have any content ideas, reach out to us by email, healthikpodcast@gmail.com. More info about this topic and more available on our Health IQ blog, qchealthco.uncil.org.
This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.